Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders. This program is presented by CNS Healthcare. I am your host, Nancy Gandolo, Chief Marketing and Outreach Officer. We want everyone to know your mental health matters and it is okay to not be okay. Today's guest is Malkia Newman, the Anti-Stigma Supervisor for CNS Healthcare. Today, she will be talking about mental health stigma and minority mental health awareness, because the month of July is Mental Health Awareness Month for minorities. Malkia, please tell us a little bit about yourself.
Thanks, Nancy. Well, I came to CNS as a client back in 2004. I was in crisis, I was homeless, and I was in a really bad way. And they were able to get me stabilized, get me on the right medication. And within a year, I had what was supposed to be a one-year job working on the Anti-Stigma Team. But the county was so impressed with the work that we did that first year that they extended the grant for 2 years, and then they made us a permanent part of CNS. So we've been stigma busting since 2005. I'm also an advocate. I've been on the board of Oakland Community Health Network since 2007 as a consumer representative. I'm one of the few peers in the state of Michigan that has had the opportunity to chair that board twice. And it's only about 5 of us statewide that have had that privilege. I'm also very active in my church. I'm an ordained minister. I can marry and bury. I haven't yet, but I can't wait for my opportunity to marry, not so much to bury.
So, before we dive into the work that you do, could you give us a definition of how stigma is perceived as it relates to mental health?
Stigma is perceived as a negative attitude or a negative opinion of people who have mental health conditions or substance use disorders. And people who are stigmatized in this way, they receive stigma from the professionals that treat them. They receive stigma from the general population. Often they receive stigma from their family members as well. So all of that leads to what I call the worst stigma of all, which is self-stigma, because then people start internalizing all that negativity, and that's the view, their worldview is one of being discriminated against and treated poorly.
Great, thank you for clearing up that definition. Obviously, you've been working to eliminate stigma for some time. I believe it's been 14 years that you've been with CNS. And do you see any differences in the attitudes since you began working with CNS and the anti-stigma program started 14 years ago?
That's a great question, Nancy. I have seen some differences in attitudes about mental health, especially since the pandemic, because more and more people were experiencing depression and anxiety that didn't have a diagnosis. So now mental health has almost become a buzzword. People understand how important it is and why we need to support it financially, why we need to encourage people who need help to get help, because it's a condition that can be easily treated.
Great. So what advice do you have for family members who have loved ones who are diagnosed with a mental health condition or substance use disorder?
One of the first things that I recommend to family members is that they educate themselves about the illness that their loved one is dealing with. This helps to separate the behaviors from the person. And once you recognize and realize this is a medical condition that's causing a person to act this way, then it helps you to be a lot more empathetic with the individual. Another thing that we like to suggest to parents or other family members is that they join support groups. There's excellent groups NAMI, the National Alliance on Mental Illness, that has several chapters all over the state of Michigan. It's a national organization. It was founded by family members who didn't have support for themselves or their loved ones, so they came together, and they've been doing this for several years. They educate themselves, they bring support one to another, and they also have chapters that work with the people who have the diagnoses as well.
Before we get into hearing about your presentations you make to combat stigma throughout the state and also country, do you have any advice for those family members or friends of people that you believe are having a mental health or substance use crisis, and what one can do to help them get help?
If it's at all possible, and we're not trying to blow our own horn, but if you have an opportunity to expose your loved one to someone else who has a diagnosis that is in treatment, that can be helpful. If you have an opportunity to see an anti-stigma presentation, get your loved one to that would be helpful as well. It helps to demystify the illness. In some ways, it helps to give hope to people who are struggling when they can see other people who have similar conditions to themselves, and they're able to see them working, living life to the full, and just overcoming the negativity that's often associated with the illnesses.
Okay, so you've mentioned peer support a couple of times, and I think in the interest of everyone that's joining us today, if we could just talk about what a peer support specialist is, that would be wonderful.
That's another good question, Nancy. Thanks for asking. A peer support is a person with lived experience with a mental health condition who has been trained by the state of Michigan to utilize their experience in a way that it helps to support others who also have similar diagnoses. It's a paid position. It's a vocation. It's not just a hobby. And once you receive your certification, you work in mental health organizations such as CNS. You can do groups with people. You can see people on an individual basis. But the main thing is to utilize your personal story to uplift and empower others to be able to do the same.
If you're just joining us, this is Bright Spot, your community connection to wellness presented by CNS Healthcare. We're speaking with Malkia Newman today and hearing about ending stigma around mental health and it being okay to receive services for mental health disorders. Malkia, thank you again for joining us. This has been a really educational panel so far. I'd love to hear about what the Anti-Stigma Team does in the community. You give wonderful presentations, both in Metro Detroit, throughout the state of Michigan, and even sometimes throughout the country. So could you talk about those presentations and how they differ between what groups you speak with and what one can expect when they hear and see you guys?
Well, mental health is not a warm and fuzzy topic. So we like to bring some laughter, some songs, poetry. We like to infuse our presentations with things that you wouldn't expect to be joined to a topic such as mental health. We want you to be educated. That's our main focus, is to educate and empower people. But we also want to do it in a way that feels good. And we've been able to implement things such as singing, poetry. We haven't started dancing yet, but don't give up on it. You never know what we'll do. We also incorporate famous people as a part of our presentation, because many famous people in Hollywood and writing and what have you have diagnoses, either mental health or substance use, and are doing some fabulous work in spite of it. We like to play games to give you a chance to interact with us and test your knowledge of stigma and other mental health related topics. We get into trauma and talking about adverse childhood experiences. We also talk about discovering the hero in you. We believe, especially those of us who have had to struggle with our mental health, that there is a hero inside of you that's waiting to come forth. And we like to tap into that and help to bring it to the forefront.
Wonderful. So, I'd love to shift the topic just a little bit. So, July is Minority Mental Health Month. And could we talk about why minority mental health is so important?
Sure, Nancy. That's a very important question. Um, the There have been studies done, and in the state of Michigan recently, they found out that out of all of the ethnic groups, when African Americans go into the ER, either for substance use or mental health conditions, that they are less likely to get good aftercare once they've left the hospital. And right now, there's research going on in 5 different counties in Michigan to try to uncover those disparities. So when you have people who are dealing with a mental health condition, which has already had some negativity associated with it, and you also have the history and other current events that play into negativity around different ethnic groups, then it just makes it that much harder on people to come forward for treatment. In fact, when the Surgeon General back in 2001, when he did a study nationwide of the mental health system, the number one problem that they saw was stigma, which is a barrier to people coming forward to get help, but that is also even more pronounced in minority communities. So that's why we want to highlight the need to specifically reach out to different ethnic groups, African American, other Hispanics, other people from different ethnic groups, to make sure that they can overcome the stigma that's associated with the mental health condition, as well as that taboo that many cultures have against mental health.
So, Malkia, that easily transitions into my next question, which is, let's talk about your advocacy. You're a huge advocate for mental health for everyone, especially those that there are many things working against them and the disparities in healthcare. And can you talk a little bit about how that looks in, Southeast Michigan and also the state of Michigan as a whole?
In the state of Michigan, as I said before, there are studies that have shown that minorities don't get the help as often as some other ethnic groups. So I've had the privilege of speaking to the legislature in Michigan. I've had the pleasure of going to Washington, D.C. to advocate on behalf of mental health. I've also done a press conference with the Governor Whitmer, to draw attention to mental health and mental health issues. So I don't take it lightly, because I consider myself a poster child for the community mental health system. Thank God for CNS. They helped to catch me back in 2004 and put me on solid ground. And I know that having the supports and the support and the programs that are prevalent in the public mental health system can do good work. I'm living proof of that. So I'm constantly, every chance I get, one of our models is I'll talk to a stick or a brick if it stands still long enough to listen to why it's so important that we support mental health for everyone. but also make sure that we're removing the barriers for other populations who may not gain access to treatment as much as needed and necessary.
I would just like to say you're an inspiration, and as one who has seen what you do, it is amazing to me how much of your heart and soul you put into your job every single day. And I guess my last question would be, what do you tell somebody who is in your shoes where you were when you first came to CNS, and not to give up hope, and, to do the work, and that it's going to be okay?
One of the things that I would tell people is where you are right now, the pain you're feeling right now, the discouragement you're feeling right now is hard. But if you reach out for help, it may be scary, and it is scary because you don't know what the future holds. But if you trust the professionals that have been placed in your life to help to lead you and guide you, they will do that. It is different for different people. Some people, they need medication. Some people might not. But we all need support. We need somebody that we can talk to, doctor, a nurse practitioner, a peer, a case manager, somebody that understands what we're going through, and connect with that individual, be honest with them, and just know that it may be a rough road, but you've already survived a rough road. It's got to get better from here. And it happened for me, and I know that it can happen for you. I was terrified. I was terrified to take medication. I didn't know how it was going to affect me. I didn't know if I would be locked away for the rest of my life. It was a lot of questions. I had a lot of questions, and I understand that. But I was able to push past all of that fear of what my future would hold. And that's why I'm as passionate as I am. And I talk to any and everybody to let them know that you don't have to suffer in silence. There is hope. There is help. And just pick up that phone and dial the number. There's someone on the other end that can help to lead you to a much better, more fulfilling life.
Wonderful. And I think we all would like to see, the day where stigma becomes empowerment, right?
Yes.
So instead of there being stigma around mental health, there's nothing but empowerment. Do you have any parting words for us before we end today's program?
That there is life after diagnosis. I heard someone say today that they use a semicolon instead of a period. That when you get your diagnosis, put a semicolon right there and recognize there's life on the other side. That's not the end of your story. It's not the end of your journey. Just keep pressing forward because there's life on the other side of your diagnosis.
Thank you so much for joining us today. This was a wonderful conversation, and thank you again for being an inspiration to so many and dedicating your life to making sure that those that need it get help, and letting their friends and family know that it's okay for people not to be okay.
Thank you, Nancy.
For everyone else, thank you for joining us today for Bright Spot, CNS Healthcare's new virtual show. We hope you will mark your calendars and continue to join us each month on Mondays at noon to discuss feelings, struggles, and finding one's way. If you have a topic you want to hear discussed, please drop it in the chat or comment on this video. As a reminder, we will select one winner for a $25 Amazon gift card and announce it next month on Bright Spot. So please fill out our 2-question survey that is linked in the chat now. Before I depart today, please remember to be a bright spot. You never know when a smile, a compliment, or a kind word can change a person's day. Have a great week and enjoy July.